Hello YouTube, I thought I would do my 28-week pregnancy update since I just had my doctor's appointment today, so while everything's still fresh in my mind. I have a special guest this time. This is my son, he's 22 months old. Yesterday he was running in the driveway and he tripped and fell, so he has a little bit of road rash on his nose and a little on his forehead. So that right there is road rash from tripping in the driveway. Okay? We just finished dinner and we're about ready to take a bath, but I thought I'd squeeze this in right between the two, okay? He really likes looking at himself on camera, so hopefully he's going to be good. Okay, my 28-week pregnancy update. I had my high-risk doctor's appointment today, not my regular one, and I actually had a very successful appointment, which is very, very good with where I'm at. I might sound like a broken record to people who've heard my last one, but with him, I had preeclampsia, and he was delivered 2 weeks early because of that. So I am being monitored for that this time. So today at my appointment, at my last high-risk doctor's appointment, they said that if I came to this one and my blood pressure was too high, they were going to up my dosage of my medicine. And it actually was really, really good, so I do not need to up my dosage of my medicine. Okay, do you want to get down? So that's good news. I also get a sonogram every time I go there, so I got to look at her again, and they confirmed again that it was a girl. I ask every time. She says for sure a girl. I also got a 3D ultrasound, but none of the pictures came out good enough for her to print for me. But I got prints of the 2D ones. I got like 7 or 8 of them. I got a bunch. Heart rate looked good. My fluid looked good. My placenta again is on the front, high up, which it was with him too. What that means is I don't get to feel her as much as other women might feel their babies. Same with him. When your placenta is in the front, it's just more cushion to have to kick through before you feel it. So I do feel her more than I did him, but still not that much due to my placement of my placenta. So it's placed well. Your placenta, as long as it's not covering your cervix, it's fine. It doesn't matter where it is as long as it's not covering your cervix. So down low. So that's good news. So placenta's good, fluid's good, heart rate was good, blood pressure was good. Basically it with my doctor's appointment. The only trouble I had today is I was supposed to have a 3:30 doctor's appointment, and I set up for my husband to meet me there at that time so he could watch my son while I was back in my appointment. And they called me at like 10:30 this morning and asked if they could move it up to 1 o'clock. And I kind of didn't have a choice. The doctor needed to leave early, so it was either move it to 1 or cancel it. I didn't want to cancel it. So that meant I lost my help because my husband could not be there at 1, but he could be there at 3:30. So when I got there, he was perfectly fine in the walking there and in the elevator and in the waiting room. But as soon as we went back to the room, turned the lights off, and the type of bed I was on for my sonogram was way too small because it wasn't a full bed. It was one where you, it's kind of like an inclined chair, and then when you lay back, they pull a tray out to set your legs on. And it was way too small, and he wanted to get up there with me. And because there's no way he would have been able, and there was no side rails, it was just drop off. And because there's no way he could sit on the bed with me and allow the sonogrammer to do her work, I wouldn't allow him. And so when I didn't pick him up, he just did what toddler does. He just freaked out. And so I'm like, I'm sorry. And she's like, do you want one of the ladies at the front desk to watch them? And I'm like, sure, if they're willing to. So he was watched by the front desk ladies. And in the middle of my appointment, one of the nurses poked her head in, and she goes, he's happy as a lark out here, so don't be worrying in there. He's perfectly fine. He's coloring and looking at magazines. I'm like, okay. And so after I was done and I walked up to the front desk to get him, he was sitting in an office chair behind the counter, and he was just happy as can be. He couldn't have been happier. So that actually worked out pretty well. I wonder if I can do that every time, because that was really nice. I went ahead and made my next appointment for 3:30 again to see if my husband can come to that one, because I don't want them to like think I rely on the front desk ladies to watch him or not. I don't know if they mind it or not. The other good thing that happened there is I have like the world's best sonogram. She was so nice. She was so patient. She took her time. She didn't rush me. After she had everything that she needed to do, she asked me if there was anything else I wanted to see. She gave me the 3D one. She chatted. She was just like the nicest lady I've ever had. So patient. I sat there for a long time watching my daughter on the screen, so it was awesome. And the fact that she was asking me, I'm all done with my stuff, is there anything else you want me to show you again? And stuff like that, so that was good news. Other things with outside of doctor's appointment, this morning, for the very first time, when I woke up, I got the most intense Charlie horse in the back of my right calf I have ever had in my entire life. It was so painful, and it was so locked up, it actually scared me. I don't know if you know this, but Charlie horses in the legs is a very common pregnancy symptom, so it's not unusual that it happened. It just scared me because it was the first time it's ever happened to me this intensely. My calf and shin and ankle were just locked, and any movement was just incredibly painful. I didn't know what to do. I just had to like flex and point my foot through the pain, and eventually it went away. It's actually a hair sore right now. It's been like 11 hours, so it's a hair sore right now. But not that bad. But man, when I woke up this morning, I've never had such a painful Charlie horse in my entire life. I'm also still battling exhaustion, yet insomnia, which doesn't make any sense, but still battling that. I'm also getting a little bit of pressure down there, which I've never had with him. I get it a little bit more when I've had a really long, busy day, which is like every day of my life. Hold on, I'm listening for him just a second. All right. So I'm pretty sure that's about it. My maternity jeans from my last pregnancy, I wanted to use again this pregnancy. I wore them last Friday because it was the first chilly day that I was going to be outside for an extended period of time. And they did not work at all. They must have been really stretched out or whatever or something. Every time I walked, they started falling down. I had to like hold my pants up all night long. It was bad. It was really bad. And we were at this ceremony with and our state representative, or our congressman was there, and some other really important people, and the news and photographers, and I was just so embarrassed that basically my pants were falling down, and my husband wanted extra help with my son, And I was like, it's hard for me to do this because my pants are falling down. Please watch them. And that was kind of a big deal. So today, I ordered a new pair. So they should be here sometime before next Thursday. So hopefully these work out a little bit better than my ones from last year's, because I cannot wear those again. So that's basically everything with my 28-week pregnancy update. I will talk again at 29.